I thought it was a very interesting talk, and I wanted to make it as simple as possible. It's one of those my favorite talks because, as you can see from this slide, it's very few cancers you can really say they are preventable. They are beatable or treatable. So let me see if this works. As I said, like I tried to make it very simple, and how we'll be talking about would be how common the colorectal cancer is. What is colorectal cancer? What causes it? What are the risk factors? Can colorectal cancer be prevented? What are the tests to find colorectal cancer early? And what, as an individual, you can do about it. And at the end, I can give you some more information about if you need any references to get more information. So, colorectal cancer is the third most common cancer in men and women in United States. It's the third leading cause of cancer-related deaths in United States. It's actually, the data says that it's about almost 80 to 90% of the cases you can prevent by regular colonoscopy screening. Now, what is colon? Colon is what I'll just say is large bowel or large intestine, is a muscular tube about 5 feet long. It's part of the digestive tract. Function is it absorbs water and salt from the food and stores waste matter. The last 6 inches of the colon is what we call as rectum. What is cancer? It's the abnormal growth of the cells in a normal lining of mucosa, or normal lining of skin for that matter, as we are referring to cancer. Cancer cells can invade and damage the normal tissue. Colorectal cancer starts in the colon or in rectum, and commonly it's often abbreviated as CRC, colorectal cancer. We don't know the cause for most of the colorectal cancers, but most likely the cause is related to the changes in genetic material in our cells, and most DNA changes are related because of our lifestyle. Now, let's just talk about the risk factors. Now, risk factors are anything that can increase or decrease a person's chance of getting a disease such as cancer. We'll talk about some few factors. Age. Most of the cancer occurs in people who are 50 and over. Diet. Diet which is rich in red meats or processed meats like beef, pork, lamb, hot dogs, bacon, they raises the risk of colon cancer. On the other hand, foods which are rich in like vegetables and fruits, they lower the risk. Why? Because they have antioxidant properties, and that's how they prevent or fix the abnormalities in the DNA, what we talked about, the DNA changes which happen. Physical activity, is also been related. The less physically active people are, we've seen more colorectal cancer in those people, and that may be directly related to their weight, obesity. It raises the risk of having and dying from colorectal cancer. Smoking raises the risk. Alcohol use in excess raises the risk. Type 2 diabetes raises the risk. Now, let's talk about the major risk factors which you need to be aware about when and be so if so happens then you need to be cautious. Now, some adults have risk factors that make them more likely to develop colon cancer, and if people who have inflammatory bowel disease, I'm sure you must have some friends who have ulcerative colitis, Crohn's disease, especially if it is not adequately controlled, it raises the risk of colon cancer. Now, people with IBS, it's a total different ball game. It does not raise the risk of colon cancer. Because some eyebrows were raised, and I just wanted to make sure that I address that. People who have colon adenoma polyps, people from families with adenoma polyps. So, if you have a strong family history with your parents have it or siblings have colon polyps, you have increased risk of colon polyps too, which can lead to increased risk of colon cancer. The same way, family history of colon cancer and some inherited syndromes as well. If you personally have history of colon cancer, it increases your risk of having colon cancer again. So, if any of these risk factors, talk to your doctor right away, and so that they can strategize and help you deciding how you can proceed or be screened for colon cancer. We talked about few risk factors. Let me tell you what precisely it means. Like when we talked about what is a polyp, a lot of people ask me about it. What is a polyp? It's a growth of tissue in the lining of an organ. Two types of polyps. They are hyperplastic polyps and adenoma polyps. And it is the adenoma polyps which increase your risk of colon cancer. It's about 40% increase the chance for these polyps to become cancer. So, it's a very good picture here. It shows you the first box is like normal colon, and then you see how the there's a polyp which is growing there, and then you have cancer or carcinoma, which is fully developed cancer there. Now, if we talk about preventing colorectal cancer, it's many of these cancers could be prevented by regular screening. What is a screening? It's testing for people for a disease who do not yet have any symptoms. And why it's important to screen somebody? The main reason is to find and remove the polyps before they become cancer, or to find cancer early when it's small and has not spread, and when the treatment can be more effective. Now, we talked about these are the people who do not have any symptoms yet. That's what. When we talk about the tests used for screening, we can very easily put them in two categories. One is, the first category would be where you can find both polyps and cancer, like polyps which can become cancer. And the other is, the category would be tests which are mainly looking for cancer. So, you've already had cancer, but you're still asymptomatic, and you're looking for the signs for any indicators which can help you find those cancers. In the first category, which where you can find both polyps and cancer, there are typically 4 procedures which we do. It's flexible sigmoidoscopy or a colonoscopy. Then there are other 2 procedures, double contrast barium enema or virtual colonoscopy or CT colonography. What they do is they look inside the colon to find the abnormal areas. The 2 top ones, the flexible sigmoidoscopy and colonoscopy, they are done by using a lighted tube which is put through the rectum, and the last two, they are done by special X-ray techniques. Now, if we find the polyps, they can be removed before they develop into cancer, and so these tests can prevent cancer. These tests are preferred if they are available and if the person is willing to go through them, because as you see, all these tests need preparation, much more intensive, more invasive, obviously more benefit out of them. Briefly, a colonoscopy is it's a thin lighted tube is put through the anus and the rectum and passed into the colon to look for the abnormal areas, and tissue can be taken from any of these areas of concern and polyps can be removed. So, if you see any area which you are suspecting that may be the early tumor developing or anything significant going on, you can do the biopsies, or if there are polyps, then you can remove them. And this is the diagram that how, if you are seeing a polyp, we can use this technique to remove it, snare polypectomy technique, and we can remove the polyp. Double contrast barium enema is you're using barium. It's a white chalky liquid. It's put through the rectum through the plastic tube and fills the colon, and a series of X-rays are done, and that shows growth of polyps protruding into the hollow space of the colon. CT colonography. A lot of people must have heard and have questions about it. Virtual colonoscopy. I'm sure everybody must have heard. Air is pumped into the colon, and then CT scan is done. And then there are special type of programs, computer programs. You can create 2-dimensional and 3-dimensional pictures, and that's how you can figure it out if you do see any polyps or any growths in the colon. And if you do find it, then you go after with the colonoscopy. Now, the other category of tests which we talked, that tests which mainly find the cancer. So, here you already have cancer, but and you are trying to detect it in an early stage, yet the person has not had any symptoms. Fecal occult blood testing, fecal immunochemical test, these are the stool tests, and then which you put it on a card and then get it tested through the primary care physician's offices, and or they do the finger exam in the office, and then they check it on a little card and test it with some chemical. And then stool DNA test. So, you give a stool sample, you collect the abnormal shedded DNA, which is looking for the cancerous changes in those cells, and for the detection, those markers for it. Now, if any of these tests are positive, you have to proceed with the colonoscopy to find out what's going on. So, to confirm the findings, and if we do find something, then remove it or biopsy it. Now, American the Cancer Society guidelines for colorectal cancer are that at age 50, both men and women should begin regular screening and have one of the screening tests. And we talked about the two different group of testing, which means it's flexible sigmoidoscopy every 5 years. We typically do it in combination of the double contrast barium enema. Flexible sigmoidoscopy tells you the lower part of the colon, and the enema, double contrast barium enema, tells you the upper half of the colon. Colonoscopy every 10 years instead of 5 years, and then CT colonography every 5 years. The reason why it's colonoscopies every 10 years is because you can go directly visualize the colon lining, and and anything abnormal, color wise, even color different. Now, you can detect a lot of flat polyps or sessile polyps through that technique and remove it very successfully. So it's relatively much more sensitive testing. The other testing which we are talking about, CT virtual colonoscopy or the double contrast barium enema, the lesion has to be big enough that it's lifting out of the lining so you can see the abnormality with those imaging techniques. Now, we also talked about the other tests, like again going back to the colorectal cancer screening guidelines. We talked about age 50, both men and women should have colon cancer screening done on a regular basis, and the tests which find mainly the cancer, we will go each of them. Fecal occult blood test has to be done repeated every year. Fecal immunochemical test should be repeated every year, and stool DNA test should be done every 3 years if we are not going with the routine colonoscopies. And again, we have to keep in mind if colonoscopy should be done if anything is found by these tests. Now, adults who are at a higher risk of colorectal cancer should talk to their doctors about their medical history to decide the best screening test and schedule for them. They may need to begin screening earlier. American Cancer Society has specific guidelines for adults who are at a higher risk for colon cancer. This shows you that if you detect a cancer early in stage, if it's very localized tumor, the 5-year survival rate is greater than almost 90%, but if it's spread, it goes down to less than 10%. And that is the reason why it is important to find out about these the early lesions. So, towards the end, so what can you as an individual do to prevent and beat the colorectal cancer? Stay at healthy weight, be active, at least 150 minutes of moderate to 75 minutes of vigorous intensity activity per week, or an equivalent combination, preferably spread throughout the week. Limit your sedentary behavior. Eat right. Choose foods and beverages in amounts that help you to get to and stay at a healthy weight. Eat at least 2.5 cups of vegetables and fruits each day. Choose whole grains. Limit red meats and processed meats. Limit alcohol, no more than 2 drinks a day for men and 1 for women. If you are age 50 or older, get tested for colorectal cancer. Talk with your doctor about which screening test is best for you. Talk with the doctor about your medical history, your family history, to find out if you need to start testing earlier or have more frequent testing. Screening tests offer the best way to prevent colorectal cancer and find it early. Finding cancer early gives you a better chance for successful treatment. Early colorectal cancer usually has no symptoms. Don't wait for the symptoms to occur. Again, treatment is more effective when colorectal cancer is found early. Any questions?